So the heart is found in a structure called the mediastinum. It is just left of the center of the heart. You have the base, which is superior to the apex, which is inferior. The heart has got 4 chambers. You have 2 atria and 2 ventricles. Both of the atria are covered by these ear-like structures called the auricles. You have a couple of blood vessels either coming into or out of the heart. This includes the superior and inferior vena cava. This is the aorta, and in the back here we have the pulmonary arteries, which are taking blood away from the heart to the lungs, and then the pulmonary veins, which are bringing blood back to the heart from the lungs. If you open it up on the inside here, we can see here is this is known as the pectinate muscle, which is found on the inside of the auricles. Here we have the right atria. Through the right atria, we have the right AV or atrial ventricular valve, known as the tricuspid valve. Blood will flow from the right atria through the right AV valve into the right ventricle. From the right ventricle, it'll go through the pulmonary semilunar valve. It's called the semilunar valve because it has what looks like half-moon-like structures. It'll go through the pulmonary trunk, through the pulmonary arteries to the lungs. There it'll be oxygenated. It'll return to the left atria through the pulmonary veins. From the left atria, it'll go through the left atrial ventricular valve, known as the mitral or bicuspid valve, to the left ventricle. You'll notice that the 2/3 of the mass of the heart are found on the left side, and by far the largest of the 4 chambers is the left ventricle. In between the 2 ventricles, you have what's known as the interventricular septum. Once blood passes through or is pumped from the left ventricle, it'll go through the aortic semilunar valve into the aorta, which is the major artery which then distributes blood through the body. You have 3 blood vessels coming off of the aorta. This is the right brachiocephalic, the left common carotid, and the left subclavian. When we listen to a heartbeat, what we're actually listening to is the sounds of the valves closing. So when we hear it, the 2 beats that we hear is described as lub-dub. The first lub sound is the sound of the blood going from the atria and the ventricles, and we hear the 2 AV valves closing. When the ventricles then contract, the blood will then go simultaneously through the left and right, or the aortic and pulmonary semilunar valve, and then when they close, we hear a sound that we call dub. So atria is contracting, lub, ventricles contracting, dub. Those are the sounds that we hear. On the outside of the heart, we have the blood vessels that supply blood to the heart tissue and drain the blood away. The arteries supplying blood to the heart tissue are known as the coronary arteries. They're called coronary arteries because they're early anatomists. They reminded of the crown of thorns placed on Jesus' head at his crucifixion. And then the blood vessels draining blood away from the heart are known as the cardiac veins. Occlusion to the cardiac or the coronary arteries can lead to what's known as an infarction. An infarction is death of tissue due to lack of blood supply. When this happens in the heart, this is called a myocardial infarction or a heart attack. That's it.